Hi there, I'm Dr. Aldo Espinosa, and I wanted to make a really simple video to help explain what dental implant options are available to you. I want to show you what they look like and what they are, so you're better informed to make the best decision available. If you're watching this video, you're probably missing a tooth, you're probably experiencing discomfort, you might be having trouble eating the foods that you want and like, you even might avoid social interactions and just things like that. And even more than that, we have to be really careful about bone density, especially if you're missing all of your upper or lower teeth. In some cases, the bone density goes so bad that even the lower face of your jaw totally collapses. So I wanted to let you know that it doesn't need to be like that. Dental implants are changing lives all across the country, and we are here in the forefront of all things dental implants. So the first step here is so I can show you what they are, how they look like, and all the options that are available to you. So let's start with option number one, or if you're missing a single tooth or need a single tooth implant. In the old ways, what the dentist used to do when we were missing a single tooth is dentists used to grind down a healthy tooth in the back and grind down a healthy tooth in the front of the missing tooth. And that way we were able to bridge the gap and put something like this. So that's something that we don't want to do nowadays. Why do you want to grind down a perfectly healthy tooth, two perfectly healthy teeth in order to replace one? So instead of grinding down healthy teeth, what do we do now? Well, the best option is a single tooth implant. Single tooth implant means that now you're replacing the root of the missing tooth with an implant. After that, you place a connector on top of that implant, and at the end you put a cap or crown on top of that. This way you have a perfectly fitting tooth. You don't do any damage to the tooth behind it. You can floss in between them, and even more important, you get to keep all the bone density around the area because you have an implant there. And if you don't have nothing, like the old ways, you ended up losing bone density there. So this option that we have here is if you're missing a single tooth and you need a single tooth implant. So let's go to the next option. The next option is what we call the implant snap-on denture. This option is a great option for somebody that is losing all of their teeth in either the upper or lower jaw. It is our most cost-effective option, and it works really good for those patients that have been wearing complete removable denture for a long time and suffering because they move, they pinch, they hurt, and they really cannot use it to eat anything. So the snap-on denture is an implant retained denture that you have two implants placed. You can do either 2 or 4, and then the denture, which is removable, when you put it on, basically snaps into place. If you listen to that snap, what it means is that when you have it on, this thing is not going to fall out like they normally do, like they fall out almost on their own. So when you have a snap-on, you put it on, it clicks in place. It's still removable, so you are able to remove it and clean it, but when it's on, it clicks in place and is way more stable than just a regular denture that really doesn't have nothing to hold on to. So if you're wearing full set of plates and you're tired of moving around, a snap-on denture, or you're tired about wearing those glues and adhesives, well, a snap-on denture is a great option for you. And it's also our most cost-effective option of having an implant supported removable denture. This is a snap-on denture. Now let's go to the full permanent arch. The full permanent arch is the top of the line option for somebody that is missing all of his upper or lower teeth. Now this set of teeth doesn't come out at all. The only person that can remove it is either your dentist or another implant specialist. With this set of teeth, you really don't need to worry again about if you are going to be able to eat something or not. This set of teeth virtually gives you back all of your biting force that you used to have with your natural teeth, and you are not restricted to any food at all. So whatever food you're trying to get, either it's a steak, if it's corn on the cob, whatever is in your mind, this set of teeth let you do that, eat those without any worries at all. And even more than that, when you have implants across your jaw, it also helps prevent the loss of bone density in your jaws and all the problems that come associated with it. One extra benefit about this is, like, in your uppers, as you can see, this is the shape of your upper, so the roof of the mouth is not covered at all like it used to be with full plates. So now you end up enjoying more your foods because you can taste them better, and also you don't have that gag reflex that sometimes comes with coverage. With this, there's no coverage of the roof of your mouth. It doesn't come out. It's 100% permanent. You can use it like your normal teeth, you brush it like your normal teeth. So you either have it, you get it, and you kind of forget it about it. So this is the top of the line option, which is the full permanent arch. So this is, in a nutshell, the options that you have from a single tooth implant to a snap-on set of teeth to a full set of permanent teeth. So I hope this video was informative, and I hope it will be beneficial so you can get all the information that you need, and so you can make the best decision that you can take to replace your either missing or broken teeth. Thank you very much for your time. I hope this was helpful, and I'll talk to you soon.